Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started. Imagine this. A parent brings their 2-year-old in for a cough and runny nose, clearly worried. The child has a low fever and is pulling at an ear once in a while. The parent says, "Can we just get antibiotics so this goes away faster?" The clinician looks at the exam and says viral bronchiolitis is most likely, and antibiotics won't help. The parent feels dismissed, leaves frustrated, tries an online remedy, and a week later the child develops diarrhea so bad they need another visit. That cascade, well-intentioned demand, unnecessary antibiotic use, and then complications is exactly what leads to avoidable harms for patients and strains on our whole community. Today, I want to give you the practical tools to avoid that scenario, how to know when antibiotics are likely to help, what the real risks are, and how to talk with your clinician so you leave an appointment confident in the plan. Before we dive in, a quick promise. In the next 20 minutes, you'll understand in plain language how antibiotics work, the common situations where they do and don't help, the harms to watch for, and 3 practical questions to ask at your next visit. I'll also give at least 3 clear takeaways you can use immediately. This is evidence-informed guidance for patients and families, not a substitute for individualized medical evaluation. If you has high fevers, trouble breathing, severe pain, or signs of serious illness, seek care right away. Let's start with the basics. How antibiotics work. Antibiotics are medicines that kill bacteria or stop them from growing. They do not work on viruses, so they won't cure the flu, most common colds, or other viral infections. There are different classes of antibiotics that act in different ways. Some, like penicillins and cephalosporins, attack the bacterial cell wall and cause the bacteria to burst. Others, like macrolides and tetracyclines, interfere with the bacteria's ability to make proteins. Still others, like fluoroquinolones, disrupt bacterial DNA processes. Each class targets specific bacterial features, which is why a drug that works for one infection may be useless or unsafe for another. Clinicians choose antibiotics based on the likely bacteria causing the infection, local resistance patterns, allergy history, patient age, and other medical conditions. A practical example. For uncomplicated strep throat, a penicillin-class antibiotic is usually effective. For some urinary infections caused by resistant bacteria, a different class may be needed. The key point is that matching the right drug to the likely organism is important. Blind use of any antibiotic increases risks without guaranteed benefit. So, when are antibiotics appropriate? The simple split is bacterial versus viral. Bacterial infections that commonly need antibiotics include bacterial pneumonia in certain cases, confirmed strep throat, some urinary tract infections, and specific wound infections. In contrast, bronchitis, most sore throats but aren't strep, common colds, and uncomplicated viral ear infections generally do not improve with antibiotics. Here are concrete decision cues you can use. Respiratory symptoms. A cough with clear, runny nose and no high fever or lung findings is usually viral. If you have high fever, rapid breathing, low oxygen, or you sound very ill, bacterial pneumonia becomes more likely and antibiotics may be needed. Ear pain. In children, ear pain with bulging, red eardrum and fever may indicate an ear infection where antibiotics help. Mild ear pain without those findings often improves on its own. Throat pain. Strep throat commonly causes sudden onset sore throat, fever, tender swollen lymph nodes, and absence of cough. A quick test in clinic or a throat culture distinguishes strep from viral sore throat. Urinary symptoms. New burning with urination, urgency, and a positive urine test are common signs of a urinary tract infection that often benefits from antibiotics. Vaginal discharge or itch without urinary signs is usually a different problem. If you're unsure, ask your clinician, do you think this is bacterial or viral, and what specific signs would change that assessment? That question helps you understand the reasoning behind the plan. Next, important harms to know about. Antibiotics can cause side effects ranging from mild to severe. The most common are upset stomach, nausea, diarrhea, and yeast infections. Allergic reactions can range from rashes to rare but serious anaphylaxis. If you develop difficulty breathing, hives, or swelling after a dose, seek emergency care. One particularly serious complication is Clostridioides difficile, or C. diff, a bacterial overgrowth in the gut that causes severe, sometimes life-threatening diarrhea and requires targeted treatment. Overuse of antibiotics also drives antibiotic resistance. Bacteria evolve to survive drugs that used to kill them. That not only makes future infections harder to treat for the individual, but it reduces options for the whole community and can lead to longer hospital stays and more dangerous infections. At the same time, antibiotics save lives when used appropriately, for example, in true bacterial sepsis, certain pneumonias, or confirmed bacterial meningitis. The takeaway is balance. We want antibiotics available and effective when needed, and to avoid them when they won't help or may cause harm. That brings us to practical safe use rules every patient should know. First, follow the exact dosing instructions. Don't cut the course short because you feel better unless your clinician specifically advises stopping. Stopping too soon can allow bacteria to survive and become resistant. Second, take antibiotics with or without food as directed. Some need to be taken with food to reduce stomach upset. Others are absorbed better on an empty stomach. Third, watch for interactions. Some antibiotics interact with common medicines like blood thinners or certain heart medications, and others affect birth control effectiveness in specific cases. Always tell your clinician and pharmacist every medication and supplement you take. If you miss a dose, take it as soon as you remember, unless it's almost time for the next dose. Don't double up. If a side effect is mild, call your clinician or pharmacist for advice. If you have severe side effects, allergic reactions, or signs of C. diff, such as persistent watery diarrhea, severe abdominal pain, or fever, seek medical care promptly. And one more practical tip. Ask for a clear plan at the visit. Questions to bring up are, what are we treating this for? How will I know if this is helping or if I should return? And are there non-antibiotic alternatives I should try first? Those questions shift the conversation from demand to shared decision-making. Now let's quickly bust some common myths. Myth: antibiotics will speed up all infections. Not true. Only bacterial infections that the chosen antibiotic can treat are helped. Myth: if I ask for antibiotics, the doctor should just give them. Good clinicians weigh benefit and harm. Asking for an antibiotic doesn't change whether it's appropriate. Myth: natural remedies mean I'll never need antibiotics. Some mild infections can be managed conservatively, but bacteria infections that risk complications still need medical treatment. Myth: if I've had an infection before, the same antibiotic will always work. Not necessarily. Bacteria change, and past success doesn't guarantee current effectiveness. The right approach is informed conversation. Know the evidence, ask the right questions, and follow the agreed plan. Before we wrap up, here are 3 practical takeaways you can use now. 1. Ask this question at your visit. Do you think this is bacterial or viral? And what signs should I watch for that would change our plan? That puts the decision on evidence, not pressure. 2. Use antibiotics safely. Take the full recommended course unless instructed otherwise, check for drug interactions with your pharmacist, and report severe side effects immediately. 3. Consider alternatives when appropriate. Symptomatic relief, watchful waiting with a clear follow-up plan, or targeted testing like a strep swab or urine test can avoid unnecessary antibiotics. If you keep these 3 steps in mind, you'll reduce unnecessary exposure, protect your gut and your community, and be a more informed partner in your care. If you found this episode helpful, please subscribe so future episodes reach more people who want clear, practical medical insight. You can also find show resources, links to reputable sources, and consultation information at facbynursejessicaconsulting.com. Thank you for listening. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at aka.bynursejessconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.